Dr. Chris Ward. Today's a planning day for me. I come into the office and I try to answer emails and questions from patients. And some of the questions that came up today, I thought, I'm just going to put a video out there where you can know more about it. And maybe if it's a question you have or someone you might know, then it'll help you along your journey. But one of the questions that I commonly get is, when's it the right time to consider this all-on-4 or full arch dentistry, or really any dentistry as it relates to my teeth are just in bad shape and I've got to kind of start over. And part of the answer to that question for most people is, what's the current situation for the patient? Do they have active infection? Are they in pain? Those sort of things. And when it deals with infection, we take three-dimensional images on our patients when they come in, so we get to see three-dimensionally how big is the infection. And it's not uncommon where we go in and a sinus is completely full of fluid, the bone around teeth are completely gone, and their body's immune system is having to fight the infection. Well, in light of any situation, but particularly in the current situation we're in, we don't want our immune system fighting other things that maybe we could have more control of. So if there's active infection, we always want to deal with it earlier than later. How much bone is available, where the bone is, will have a direct effect on what type of implants, the size of the implants, the length, how stable they'll be. It just has implications on the final result of what we're looking at. So honestly, when's the right time? Sooner is always better than later when they have active infections. Now, some of that question, honestly, as I look at it, it's, when is it the right time? But it's really can be a question of, when's it going to be a point where it's worth it, or I'm worth it, that I'm going to spend the money and do this? Because quite frankly, a lot of my patients have kind of poured into their family. It's an investment to do these sort of things. And so it's like, am I worth that much money, or whatever the investment is, when I should be pouring into my family, or I should be doing other things with it? And some of the question with that is, what are you not able to do now that you could do so much more and be so much more if you weren't held back by this? What I see so often in consults, and this is one of my consult rooms, but one of the things that I see is, all the pain, all the weight, all the embarrassment, all of the things that they just hold on to, that really their perception of who they are is so skewed, and yet that's their lens. And until we get to help transform that, it's hard for them to come out of that. So sometimes when the right time is when you finally can get up the confidence to say, I am worth this, and it is worth it for me to invest in myself, because I do want to be all that I can be. So that's something that I hope helps you.